I'm Dr. Jennifer Cook, professor in the School of Kinesiology and Health Science at York University, and I'm tasked today to talk to you about how to eat healthier for cheaper. I was given a case study, so today we're going to talk about Maria, who's a single mother of two, who struggles to provide healthy meals for her family. So she has limited transportation and limited money, and so she relies on the local grocery store, which has local quality produce compared to others, and she's noticing that her children are less active and are becoming ill, and she herself has high blood pressure and diabetes. And despite her best efforts, Maria can't afford medications and her health is getting worse. So unfortunately, Maria is not alone, and there's actually 1.8 million Canadians who are food insecure. And so what food insecure means is that you do not have reliable access to enough affordable and nutritious food. So what this means is that you might cut the amount of food that you buy, or you eat less than you need because you simply can't afford it. And so this is a growing problem, and more people are food insecure. And in Canada, it's about 1 in 8. And so what that means is that 1 in 8 families can't afford the food that they need, or they need to cut some other essential things in order to buy the food. What we see is that the amount of money that you spend on food is actually negatively related to how much money you make. So over here are the people who are low income. So that means that they make about $30,000 a year, and they end up spending about $144 per week on food, which is about 25% of the money that they make. Conversely, if you look at the people who are in the middle income, so they're in the about $60,000 per year, they spend $115 per week on food. And so you can see that's less than the people who make less money, and it's also a smaller percentage. So it's only about 10% of the income that they make. When you go to the richest Canadians, you can see that they're spending more money in an absolute dollar sense. They're spending about $240 per week on their groceries, but it's only 5% of their total income. So you can see that from an absolute sense, in terms of the number of dollars, those who are low income are spending more than those in the middle, and they are spending a larger percentage of all of their income on food. And why it's so expensive is because when you have a low income, you are often limited in where you can buy groceries. And so this was a news report done by the CBC, where they basically showed that if you buy the same things from your local corner store as compared to your supermarket, you're likely going to have to pay more for a lot of these quote-unquote essential foods. And so what this equals is about a 36% difference. So you can see, in order to buy the same things at somewhere that's accessible and local to you, might make a large impact in the amount of money that you're spending. Okay, so because again, so like Maria, who doesn't have a car, she can't drive to the supermarket that might have better prices. And so in the end, you're spending more money for the same things. And so when you look at Toronto, and this is true in many areas in the GTA, is that you may or may not be close to the type of grocery store that you want. And when you take a look at the amount of fast food restaurants that you can see in the stars, they are scattered all over the place, particularly in the places where there's a very low income. There tends to be a lot more of these fast food restaurants. When you take a look at the downtown core, there are many grocery stores and also fast food restaurants, but depending on where you live, you're going to have close access or choices to where you shop and where you eat, as compared to some other places where there might not be a grocery store that's close to you, and really it's fast food restaurants or small convenience stores where you're going to have to pay a lot more for your groceries. And so when we take a look at, where Canadians live relative to the grocery stores, the number of Canadians who have an easy access to grocery stores has dropped since the 60s. And so as opposed to 75%, where nearly everyone had easy access to the grocery store, it's only about 20% now in 2005. And so what they defined as easy access means that you could walk to the grocery store within 10 or 15 minutes, or a 10-minute bus ride without transfers. So, and this might be more or less relevant depending on where you live, and then whether or not you have a car. And so when you take a look at Canadians, depending on where you live, about 5 to 45% of people don't have cars. So in the downtown core, for example, there's a lot more people without cars as compared to the suburbs where almost everybody would have a car. So one of the ways that you can save money is buying in bulk. So if we look at toilet paper, which you can argue whether or not it's essential, you can see that, you know, this bulk club pack is now $20 as compared to the smaller pack, which has less than half, which is $10.97. When you figure out the cents per roll of toilet paper, you can see that buying in bulk, you pay 67 cents per roll, whereas the smaller package, you're paying 91 cents per roll. So you have to pay double in order to get that 26% in savings. Okay, the other issue with buying in bulk is not only that you have to pay more money right at the up front, which you may or may not be able to do if you're living paycheck to paycheck, is that you'll also need space to store it. And so if you live in a small apartment building, for example, you might not be able to take advantage of sales and stock up because you don't have the space to put all of these great deals. So again, forcing you to pay more for the smaller amount that you have space to actually use. But this means that you have to buy it more regularly. And again, it contributes to you spending more money. When we look at meat, you see the same type of thing. So this is, you know, President's Choice, the same brand of chicken thighs. You can see that, again, you're saving money by buying the bigger package. But again, if you're not going to eat it all at once, then you need somewhere to store it without it going bad. And so again, having that freezer costs money, the electricity to run that freezer, all of that costs money, again, up front that you need to pay for it so you can have these things in order to take advantage of the cost savings. Okay, which brings us to the F word, frozen food. So a lot of people think that frozen food is not better than fresh food, but this is actually a myth. When you take a look at factories that freeze the food, they're actually located very, very close to where the food is grown. And so what this means is that the food that you're freezing can be picked closer to when it is fresh. And then the freezing process actually maintains the nutrients actually better than putting it in a refrigerator. So depending on how fresh those blueberries are at the grocery store, they might actually have less nutrients than the frozen ones. And so when you take a look at the cost, you can see that there's a substantial savings in buying frozen berries as compared to fresh berries. And this is in part due to the fact that you have less wastage when you freeze it as compared to fresh. When you go through your grocery store bin of blueberries, you can always see that there's typically some that have gone bad. And so all of that is food wastage that you avoid with frozen berries. So if you take a look at spinach, it's the same type of deal. So here's the spinach, no-name spinach from No Frills, and you can see that there's a substantial savings for getting the frozen chopped version as compared to the fresh or bunched. Okay, especially if you can have that freezer space to take advantage of that sale. So again, you might ask, well, why is it that these frozen vegetables are so mushy and they don't taste as good as the fresh vegetables? And this is because if you remember back to your biology class, vegetables have cell walls. And so what happens when you freeze the vegetables is that the water within the cell bursts the cell wall. So your vegetables tend to be a little bit mushier, but the nutrients that are in those vegetables are maintained in the freezing process. So if you buy something that's a little bit less fresh, again, it's going to have less nutrients than the frozen version. And again, this is really important because when you take a look at some of the discount grocery stores, not all the food that they sell is quote unquote fresh. And so this is the No Frills that I visited, and you can see that this lettuce was on sale, but you can also see it's already starting to go bad even at the store. And so when it's starting to go bad, it's losing its nutritional value. So the amount of vitamin C, a lot of those vitamins that you're trying to get from your vegetables is actually going down, especially, and if they're already going bad, you're going to be throwing away a lot of the food produce, especially if you don't eat it right away. So if I buy produce from, for example, a No Frills or Food Basics, the food tends to go bad within a few days, whereas if I buy it from like a Fortino's or the Costco, it can last a week before I start seeing spoilage. Okay, so again, this is an issue if you live only close to low-income grocery stores that don't have the freshest produce. Okay, so again, frozen foods are picked at the peak of freshness and they're frozen quickly to maintain that nutrient value. And so if you can think of creative ways to use those frozen vegetables so that you don't notice their mushiness, then it's a good way to save money and also be healthy. The other thing I wanted to talk about is a lot of healthy produce, processed foods are still unhealthy. And the food industry is there to make you buy their food, not to actually make you healthy. And so they market a lot of these things like the sun-ripe fruit to go as being healthy, like a substitute for fruits, when in fact that's not true. And so when you take a look at the amount of sugar in the fruit to go as compared to the Oreos, you can see that it's actually more. And when you count for the fact that it's a smaller portion size for the fruit to go as compared to the Oreos, it's actually 50% less sugar and 32% more calories for the fruit to go as compared to the Oreos. So from a sugar standpoint and a calorie standpoint, you're actually better off eating the Oreos than you are the fruit to go. And when you take a look at the vitamin C, it's a whopping 0 and 2%, which is almost nothing when you're considering that you're supposed to be eating fruit. And so again, something that's marketed as healthy, only 50 calories, no preservatives, no artificial colors, it also doesn't have the vitamins that you'd expect, given that this is supposed to be made from fruit. Okay, yogurt drinks are exactly the same type of idea where you're trying to market this milk with fruit to make it even healthier. But when you take a look at the number of calories from sugar, almost 3/4 of the calories are sugar, which makes it actually no different from juice. When you take a look at the vitamin C, there's actually no vitamin C, which is surprising because one strawberry itself should have 10% of your daily vitamin C needs. And when you take a look at the calcium, it's actually less than what you'd get from a glass of milk. So again, you're paying more for this packaged drink and you're actually better off just drinking the milk. Okay, Go Squeeze is another fruit product which is marketed as being 100% fruit and super healthy. But when we take a look at as compared to the apples, it has less, so 2 grams of fiber versus 2.5 grams, which should be in an apple. When you take a look at the sugar, again, this Go Squeeze has more sugar than you would have just eating an apple. And again, 0 vitamin C, which is again surprising because you're coming from concentrated apple juice, which is essentially sugar water. Okay, and so it's missing the vitamin C. So again, when you're taking a look at the Go Squeeze fruit sauce, you're better off eating that apple. Okay. Another one, this is one of my kids' favorites, looking at the Fruit Sensation, which is vegetable gummies, right? So this should be super healthy for you. And again, when you take a look, it has 100% vitamin C, which is amazing until you look at the ingredient list and you can see this is actually another name for vitamin C. So they've done a lot of processing, which has removed a lot of the nutrients that should be in the fruits and vegetables, and then they've replaced it with artificial vitamin C in the product instead. So again, this is another example of something which is pure sugar, okay, and the vitamins just added back after the case. So again, you're better off eating that fruit and you're better off eating the vegetables as compared to these gummies. Okay, so I'm going to give you a quiz just to show you how misleading some of our food products are. So if you looked at our Danone strawberry yogurt versus our Starbucks chocolate croissant, I think most of you would say that this is the unhealthier thing that has more sugar. But when you actually take a look at how much sugar there is, there's actually only 10 grams of sugar in the croissant versus 24 grams in the yogurt. And so again, it's misleading. And when you try and make the right choices, unless you read the labels, you might be making the worst choice. Okay, so again, if we go to Tim Hortons and we have the whole grain raspberry muffin versus my favorite, the chocolate glazed donuts, again, we're seeing something similar where the whole grain muffin has more calories than the donut, has more fat, it has double the fiber, but when you consider that this is double the size, our whole grain raspberry muffin actually has no more fiber than the donut. And so you kind of question, is it actually whole grain and a good fiber source? And probably not. And again, the food industry is there to sell you food, not necessarily to make you healthy. When you look at the grilled chicken sandwich from Boston Pizza versus the Whopper at Burger King, you can again see that this grilled chicken sandwich you might think is a healthier option, but it has more calories, more fat, and also more salt. So again, questionable if you're actually making a healthier choice by going with the grilled chicken sandwich over the Whopper, which I think most of us can agree is probably not a healthy choice. Okay. If you go to Eastside Mario's, are you going to choose the salad or the fried calamari? Again, more fat, 7.5 times more fat in the salad and the same amount of fiber. And so again, unless you read the nutrients, there's a lot of misleading things in the food industry that are making us think that we're making the good choice, but in fact, we're not. Okay, so the booster juice is something I see a lot of York University students walking around with. And again, if you look and we're comparing the same size of booster juice to a can of Coke, you can see that the number of calories in the can of Coke is actually less than most of the booster juices. And when you consider that most of the booster juices are double the size of the can of Coke, there's actually more calories and more sugar in the booster juice than there is in Coke. Okay, so when we take a look at the next part of our case study, Maria is noticing that her children are becoming less active. And so why is this? And so what we see is that over time, this is the perceived level of crime for the people. In the blue is that they think that over time crime is increased in their neighborhood. The red bars, they think it's unchanged. And then the dark blue here are they think that crime is decreasing. Now, in contrast to what people think, that they think that crime is increasing over time, it's actually decreasing over time. Okay? And so what this means is that people are perceiving that their neighborhoods are less and less safe, when in reality, there's actually less major crime in our Toronto neighborhoods. And what this means is a lot of people don't feel safe sending their kids out to play. And I think this is more in part that we don't know our neighbors anymore. So in the 80s, everyone knew your neighbors and the kids would run out and it would be safe because everyone knew everyone. Whereas nowadays, people can live beside the same people for 10 years and still not know who they are. And so this has created a society of fear where kids can't go out to play. And a lot of them will have these active video games, which you might think are a good substitute, but when you actually take a look, you can't actually raise your heart rate or get the fitness benefits of going out to the park or going for a walk when you play these active video games. So even though they might be better than just sitting there with your traditional video games, they're actually not a healthy choice. And so when you take a look at over time, only 5% of kids are actually meeting the physical activity recommendations. And so this is really, really important that you get out and go for a walk. Okay, and again, take your parents with you because only 15% of adults are actually getting enough exercise. And so every day, kids should be getting at least 60 minutes of exercise and activity outside. Okay. Now, the last point of my case study that I wanted to talk about is Maria can't afford medications that she needs and her health is getting worse. And so we live in Canada where we have universal health care. That means you can go see the doctor for free, you can get hospital visits for free, but medicine is actually not covered by OHIP or our government plans. These are things that we need to pay for, or you need to have a job where they give you health benefits that cover these medications. And so what this means is that a lot of people with low-paying jobs either don't have health insurance or their health insurance doesn't fully cover the cost of their medications, which is another added burden for them that they have to pay out of pocket for. And so this is why a lot of people who are poor don't take their medications and their health suffers as a consequence. And so this is something that, OHIP Plus, right now they're talking about having more government funded medication plans so that people can get the medication they need, particularly the people who can't afford it, who need the most help. And this is why people like Maria tend to be more unhealthy than people who are richer. And so it's important to remember that being healthy takes effort and money. So if you're going to that grocery store, it takes effort to plan out and compare costs and try and get those cost savings. And you need the space in order to store all of those good deals. And remember that short-term junk food makes you feel good. And sometimes when you're stressed, you just want to have that the chocolate bar, the chips, just to make you feel better, something to enjoy. And so being poor is stressful, so that makes for making those right choices even harder, even if you know what is right. And so I encourage you, if you do know a Maria, that you encourage them and maybe help them. And things like food banks where we have healthy options in those things are going to help these individuals. But again, access is going to be hard if they don't have that transportation or that time to go out of their way to seek those healthier options. Okay, so I know I might have not given you the answer you were looking for, but unfortunately, this is the reality, and this is why individuals who are poor from lower incomes struggle with good health. Okay, hopefully you learned something, and have a good day.